The Merck company announced that they have completed a trial of a new antiviral drug that can fight COVID. Shortly after infection, if you can take this pill, then you can reduce the risk of serious hospitalization and dying by 50%. The Merck company has submitted all this information to the Food and Drug Administration. They have to study it very, very carefully, look at the benefits, but also look at the side effects of the drug. And then everything going well, my fingers are crossed, we would get an emergency use authorization, perhaps as early as 8 weeks from now. Having pills available that can prevent the evolution into serious disease would change the way we can treat. At the moment, people who are newly infected have to come to special treatment centers to receive their intravenous infusions. We could give them now, or in the future, a prescription. They could go to their pharmacy and take their medication the way they do other medicines. This would allow us to treat many more people much more quickly, and we trust much less expensively. We're used to treating influenza, another nasty respiratory infection, with Tamiflu. And this new drug, like Tamiflu, interferes with the multiplication of the virus. That means although the virus is already in our bodies, if we can prevent it from multiplying, it can't spread further in our bodies, and thus our disease severity is lessened, the illness is shortened, and of course, we're prevented from needing hospitalization and we're prevented from dying. And so the sooner we can get that treatment into you, the greater the anticipated benefit. Prevention is the highest goal of medicine, and that's where the vaccines come in. The vaccines prevent the disease completely. That's much better than having the disease develop and then having us rush to try to find a treatment that is at its best partially effective. So the need for vaccination, the imperative for vaccination continues. That's the foundation of how we can get ahead of COVID.